Lamborn Town Hall.
Managers lie, benefits die.
Yeah, that's what I have about healthcare. And that is, our nation's Constitution gives enumerated powers to Congress in Article 1 on what we should be doing in Congress. And I think a lot of times Congress steps beyond those boundaries and does things that state governments should do, or frankly, no government should be doing. But, just because there's a problem doesn't mean that we need a federal law to address that problem. We have communities, we have states for each other there's been a lot of good amendments that have been rejected. One of those, for instance, was by Orrin Hatch saying we won't have taxpayer funding of abortion. In the No. Orrin Hatch really did offer an amendment that was turned down in the Senate Finance Committee, saying it's a...
But it's not in there.
I assume it costs too much, simply. For instance...
Stop it.
For instance, there is a... for those who have more generous plans, the so-called Cadillac plans, or just anyone who wants a more extensive or comprehensive plan, they will be taxed on that plan according to the Baucus version of the bill. And there will be a 40% excise tax put on those more generous plans. So, right there we have a tax increase for anyone who has...
You lie!
And I'm quoting the Joint Committee on Taxation, its report, Estimated Revenue. But whatever it is, you will face a fine. If you don't pay that fine, you are subject to a 1-year jail sentence.
Not true!
Quiet, Obama Bob.
And that's according to CBO Director Douglas Elmendorfer. Sent a letter to Senator Baucus dated October 7th. So this is all documented.
It's on the record!
Also, there will be $23 billion that will come from employers. Those who can't provide the government-required health plans for their employees will pay a fine, and that's estimated to be $23 billion. There will also be $38 billion in the Baucus plan raised from medical device manufacturers and $22 billion from pharmaceutical companies. This $60 billion, I believe, is not a good thing. Two things are going to happen. It'll be passed on to consumers, you and me, and or it will discourage them having the money to spend on research and development. That's going to hurt their budget ability to research and develop new devices or new drugs that will prolong our lives in the future. So that's also, there will be higher congressional budget office. There is a PricewaterhouseCoopers study released on October 11th that estimates that the cost of family coverage will go up by $4,000 per family.
Another lie.
That's according to Pricewaterhouse, to the extent of
Constitution, don't even
$120 billion
so that's why I get to do this.
from cuts for hospitals.
That's the opinion of...
You lie!
$40 billion.
Stop scaring to see your citizens! Stop scaring to see your citizens!
Excuse me. Medicare is slated to go bankrupt in 8 to 10 years. So I don't see that that's a good source of revenue for an entitlement program that's of a massive size in itself. Now, some other concerns I have with House Bill 3200 are that it costs too much, it controls too much, and it covers too few. Just to summarize, the Democrats in Congress in H.R. 3200, their bill, unlike the Baucus bill, this is a slightly different twist because it has the government-run program first and foremost.
Shut up!
Anyway, it's right here. This appeared in the magazine Lancet Oncology. Please, I ask for some courtesy back here. I ask for some courtesy.
That information is a lie. Take it out of your mouth.
Okay, look at the survival rates for cancer in the United States versus other countries that have socialized medicine. For prostate or breast cancer, the U.S. rate of survival after 5 years is higher than in either Canada, Europe, or England.
Medicare is government money.
But H.R. 3400 is a bill I'd like you to look at.
Isn't that
H.R.
Medicare?
3400
Medicare
is a Republican plan that increases access to
This one right here. Go get the police right now, ma'am. So here's your picture. You find yourself with a civil suit.
No, ma'am. I didn't do anything. I am a United States citizen. What are you? Well, then do him the respect to keeping your mouth shut.
You guys don't respect the next time. Leave the lady alone.
I'm gonna call her racist.
I'm from downtown, you little redneck. Hello. How are you?
Hi.
You doing okay?
allowed to speak, I'd like to present to you my concerns with the current majority Democratic proposal in both the House and Senate. I don't want no American should be forced to have government-run health care. Yes, on legislation should be enrolled in the government program. But I prefer that no one is forced into a government program, period. Okay, let's take a question here for this second. The lighting isn't the best, I'm sorry. Ma'am.
We only learn from you guys. You're the ones who've been doing this for a couple of years now.
Good golf course.
You guys. When we have town meetings, when we try and talk to you guys.
It should be estimated at $1,900. That could go up or down. You will spend up to a year in jail or pay a $25,000 penalty. From the health insurance law. Okay, I haven't seen where PricewaterhouseCoopers recanted their plan, which was only issued 8 days ago.